Good afternoon, my name is Soto and I'm creating this video for my class surgical procedure. This is for lesson 4 and I'm all set up, sterile, and I also have my boots on. You can see it. And then on the table here, since I only have one table at home and I have my tools set up, I have my DNC first, and then towards the end I set up my little back table and the tray right there. Here are the instruments that I have so far. Okay, what do I have in here? So the first thing I have with me, I'm gonna talk about the hysteroscopy. And the hysteroscopy, for that you're gonna need a machine, you're gonna need a light source, and then from the light source you're gonna need to connect the cystoscope, telescope, and they come in different size, not a different size, but they have different kind for different things, for diagnosis and to help with the control of the flow, I should say. Okay. And this also depends on the patient's anatomy, like how big the patient is, how small, how tight or how big the anatomy of the size of the urethra is. Okay, so we do need this for hysteroscopy. We also need what is called the biopsy forceps. The biopsy forceps to pick up anything from the bladder and or from the wall of the bladder and to do a biopsy, cut small biopsy. Okay, so we need this. This is the rigid angle cut biopsy forceps. We also need what is the cystoscope, okay, which is a double bridge. See if you can see this in there, yeah. And this attaches to the control fluid during the procedure. Okay, the cystoscope is used to be just to look inside the urethra and the bladder. Okay, so that's that. Also we have, for the same thing, we have the flexible biopsy forceps. It's a thin, long instrument, and this one is very flexible, like I said, for a biopsy, and it goes inside the bladder for easy access of it. We also need ring forceps. Okay, ring forceps are used to clean inside the cervix with ionized providine. So we clean that with 4x4. And then we also have some provider likes to use a handy hysterectomy clamp forceps. The same thing, just to help to clean or to clamp anything that they might need to clamp in the inside. And the vaginal, we also have the open for hysteroscopy as the vaginal open speculum and the side open speculum, I'm sorry. Okay, so it looks like this. It is easy because you can put the instrument, am I doing it right? Right here. It's easy because you can put the instrument right on the side here or take out, and you don't have to be fighting with like the ones that are closed instrument. Like this one is a closed, yeah, this is a closed speculum. You can see that there is like a circle right in here, see? It's closed, while this one, you can see it is open. So pretty much you can put like any cable, any instruments, any forceps or anything like that, and you don't have to be fighting to get inside. So preferable for a hysteroscopy and open spec. Oh, not preferable, it is. We need the open speculum for the hysteroscopy. Also for the DNC. Okay, so that's that. We also need, based on what I was reading, the Russian forceps to grasp anything or remove small bones or small samples from the inside. Let's say they did remove something and it by accident just got, not accident, but it just got loose, and so you can use this. Okay, That's that. And then if you need any more help with opening the vaginal area, we have what is called the vaginal speculum. Okay, and this is just a semen retractor. Right here. A retractor. Okay. Now I have all the instruments in here for prepping for DNC. So DNC is the dilation and curettage. It's normally done for patients who have heavy bleeding, or patients who have, or they do it for diagnostic too, heavy bleeding, or for patients that have a miscarriage and they still have product of consumption inside. And so the physician or the surgeon will help them remove anything like that, or if they have like a polyps or anything like that, it will help. Okay, they use the single tooth tenaculum. Okay, and this is just to hold the cervix down. Okay, it helps for better view when they do the DNC. We have also the double tooth tenaculum. This one looks a little painful. Okay, but this is also goes on the cervix. Okay, we have the dilators, very important because we need to dilate if the patient is not open yet. We need the different size of dilators. These ones here are the Hager cervical dilator, and like you see in here, they're different size. Okay, so it all depends on the cervix or the size of how much it needs to be dilated. So we have this ones in different size, and then we also have the Hank cervical dilator. And I think this is based on the surgeon's preference, which one they'll like or pick to do the DNC. Okay, so this is just to make sure to dilate the cervix. And in here, you can see it, but these dilators, they have like a measuring a number, and so they base it on like how big or how deep it goes in, and then how thick, like how big the hole is. Pretty much it goes from very tiny to a little bigger, and so it's different size in there. Okay, I have here for draping the patient, we use the towel clips. So I know we need like 3 or 4, maybe 4 to clip or to prep the patient or to drape the patient and to hold all the drapings around. Okay, we have the Mayo scissor. We need the Mayo scissor to cut. Sorry, I didn't take it out. To cut, and it's easy because it's straight, and it just cuts the suture or dressing. Okay, we also have what is the Metzabon scissor. Okay, so the long one here, a little curve here too, and this one is used for dissecting like very delicate tissue. Okay, so that's that. We have the Mayo curve scissor. We have a straight and we have the curved one. Okay, and again, this one is used like very tough tissue or heavy tissue that you had to cut. Okay, we have 2 similar instruments here, which are the Cali forceps and also the cryo forceps. They're like very similar, but they're also used for different type of things in the inside, or to like hold, suture, or to grab. Okay, the needle holder, we also have the Mayer Hager needle holder. Okay, this one is just, well, it says a needle holder, right? Is to hold or to suture. Okay, we go down to, we have the single tooth forceps with T, very tiny to grasp, to put, or to hold, and it, like I say, has the little, can barely see it there, a little bit, the little teeth right there. Okay, and this one can is a medium one, and you can hold on heavy tissues. Okay, for this we also have what is the knife. The knife number 7 or 3, we have the long, the short, here. Okay, 3 different knives, and they hold different size of blades. Okay, this normally is used to like primarily cut the midline or like the cut in on the belly or on the stomach, and then insert the instruments if it needs to be insert like the trocar or any other instruments if they do an hysteroscopy inside. Okay. We also have here the 2. We have one with T, and the other one doesn't have any T. This one is sharp right here, right there, so it presses or clamps. Okay, so this is usually for closing the layers. Okay, and then the one without the T is for frio items or to hold anything inside, or if you want to hold like something that is in the way, you just hold it with this. Okay, and then finally I have the tissue forceps with T. There's a different one too. It's kind of hard to see. There we go. Okay, and this again is also to hold like medium to heavy tissue with T. Okay, the DNC, when they do the DNC, they also like to do what is called the endometrial cervical biopsy, and so they use the uterine curettage, and they have different size too. The one that I seen used a lot, it's the first one, but again, I haven't been in the OR to see what other type they have, but the ones that I have used with is the first one right here. And so during the dilation and curettage, the function of this instrument is to scrape the inside of the uterus, and then due to retain content or excessive bleeding. So with this, they just go in and kind of scrape sample and grab that and send it out for the biopsy. So very important that we have this, or I have this in the OR, or when the patient is coming in for a DNC. Okay, and I think that's it. I don't have anything. Thank you.